All right. Good evening, everyone. So, I am Dr. Utsav Bhattacharya. Many of you might be knowing me. Well, right now, this video that I'm going to make, this is a different kind of a video. Usually, this is not the usual kind that I make. So, basically, the idea is this that recently the NEET exam is over. The NEET UG exam I'm talking about. So NEET UG exam is over, and a lot of people are who have scored good. They are talking about what colleges to join and what stream to choose, what are the best colleges of India, and so on and so forth. So there are these are the discussions which we can always have. So that's not an issue. But the thing is this, so a few people I came across, they have no idea or not much idea about what is BDS. Okay, so I thought that as a aspirant, at least a person should have an idea about what is BDS, because in my clinical practice also I have come across this situation where I have seen people, they have a good knowledge of what is MBBS, but many people, even layman, leave aside aspirants, they do not have much idea about BDS. So this video is all about giving you an idea about BDS, and if you watch this video till the end, then at the end you might have an idea whether to take this up. And if you are selecting this stream, then why are you selecting this stream? If you are rejecting this stream, then why are you rejecting this stream? So you will have a clear cut idea. So we will talk about the general overview things, and in case you have any specific query, or if you think that I have missed out something, so that portion you can always put it in the comment section. So let's start the video. So basically, if we talk about BDS, so it is the degree is Bachelor of Dental Surgery. I'll try to make the things a little bit more simpler by creating a comparison or a contrast with the MBBS, about which a lot of people know about it. So I'll just trying to bring some comparison. I'll try to bring some contrast for making for try like so that the thing becomes easier for you. So if we talk about MBBS, so it is basically Bachelor of Medicine, Bachelor of Surgery. So similarly, this one is BDS, so it is a Bachelor of Dental Surgery. Definitely not dental science. This is not a non-clinical branch, it is a clinical branch, so it is all about dental surgery. So if we talk about the entire curriculum of BDS, so this is also a 5-year curriculum, just like the MBBS curriculum, and it is followed by a 1 year of rotatory internship, and that is definitely mandatory. Okay, so a lot of people, they have an idea that MBBS is basically of 5.5 years course. Well, the years are 5 only, but over there what happens is some of the years, their span is not 365 days. The span is a little bit longer. Say second year, the second year subject, it can go till like 1.5 years. So if second year is for 1.5 year, and then third year is again 1 year, then fourth year is again another, it takes 1 year. So if it happens in this way, so the fourth year will be completed at the end of 4.5 years. So if you add 1 year of internship to it, so that becomes 5.5 years, and that 5.5 years is 5 years for the BDS. Okay, so this is the difference, because in BDS the second year gets over in 1 year only. So if we talk about the entire subjects which are covered in BDS, so the subjects are you will see the subjects which are common for the MBBS students. Though I will talk about those subjects first. Like, there will be anatomy, and when I say anatomy, it is general anatomy, and anatomy includes the general embryology. It also includes histology. Histology is all about the tissues and all. So these are all common topics which are there in the MBBS curriculum also. Along with that, there is physiology. Once again, it's general physiology. There is another thing which is, there is another subject present abroad, that is called as oral biology. Now that here the students, I don't know about current scenario, but like during our days, out of interest we used to read that, but it never used to be subject specific. It is a part of the curriculum. I'll come to that part in a while, but nobody really bothers about it much. So when we talk about physiology, we mean the entire general physiology that is there in the curriculum, and along with that there is general medical biochemistry is present over there. So all of these things are these things begin as well as end in the first year only. Now in second year, just like the MBBS counterparts, here also you will study general pathology and microbiology, that like the entire big subject, microbiology, parasitology. Okay, so that it's a big subject. So you will talk about, you will learn about that, and after that you will learn about the general pharmacology. So all these things are very very common for both MBBS as well as the BDS students. Now here there are some topics which will come up, which are very very specific for the BDS. These are not taught in the MBBS curriculum. So in BDS curriculum, there is an entire subject called as dental materials. So this is all about the material sciences that are used in this entire dental surgery curriculum. There are, like numerous materials used. There are very, very thick, fat books are there where you have to read about lots and lots of physics and lots of chemistry in it. So it's not like really connected to only biology, but here you have to learn about the, like sort of the application of physics in the biological world, application of chemistry in the biological world, and how we are using it in the human body. So that is the subject all about. And after that I can talk about another subject that is called as periodontology. Now as I am discussing this topics, this is important not only for NEET aspirants, but if any layman really wants to become knowledgeable about the dental surgery, they should also know about it. Because if you talk about the MBBS curriculum, then if you ask somebody, a random stranger, that can you tell about some specialty in like after MBBS, so many people can say that okay, there can be surgeons, there can be MDs, okay, there can be derma, and they can talk about this eye specialist, ENT specialist, they will talk about all these things. You ask them about the specialty or specialization after BDS, I don't think many people will have a clear idea about it. So now the discussion that I am doing, these are the special topics which are the special, not topics, they're special subjects which are taught in BDS curriculum. And not only that, these become the specializations in future. We will talk about that also. So like if you really want to become knowledgeable about the specializations after dentistry, then you should pay attention over here. So we can talk about periodontology. So it is like odonto is the tooth and peri means the periphery. So periodontology means it is a department that deals with the, or that specializes with the structures which are present surrounding the tooth. So that is periodontology. Then there is another department that comes up, that is the prosthodontics. So it is a department which deals with the prosthetics. Okay, they deal with not only false teeth, but most of the people have an idea about the false teeth, dentures. What many people don't have idea is that there are some different other kind of prosthetics which are needed. Say a person has lost his eye, okay, the entire eyeball is gone, okay, there is a some war veteran who has some brave soul who has fought so well, and somehow some explosion took place and lost half of the face, or maybe lost one ear. Okay, maybe some disease has occurred to some person where the entire nose is damaged. So false, all these prosthetic nose, prosthetic ear, okay, so all these things are scientifically and biologically they are made. So that department, so it starts, it has got a wide array. It starts with false teeth and it ends with the maxillofacial prosthetics. So they can fabricate anything on the head and the neck region. Okay, so they're so smart. So that's the prosthodontics. okay, or you can also call it as a orofacial prosthetics. So you will see that there are a lot of similarities, like in medical science also. If you see that there is a person who has lost his or her legs or hands or something, so there are some prosthetic arm, okay, prosthetic foot, okay, all these things are nowadays fabricated. So this is also similar thing. So like I told you, I'll try to draw some similarity to explain things to you. So I'm just trying to do that. Then comes up another department, and that is oral medicine and radiology. So just like there is a radiology department in MBBS, similarly here there is a radiology department. So in your head and neck region, there are whatever CT, MRI, okay, even there is something called as a pantomograph, okay, any kind of x-rays that are needed, okay, in layman term you can call it dental x-ray, but there is a variety of dental x-ray. When you will visit some dental surgeon in India, so they might ask you for different kind of dental x-rays. So they have different names, okay. So all of these things, their analysis and everything, they are done in this department, okay. And along with that, this same department, they deal with the oral medicine. Just like there is general medicine in MBBS, here there is oral medicine. It's the same subject, but here the specialization is like the department is highly specialized on the oral aspect, the diseases related to the oral aspects and how to treat them, okay. Because as we see the current scenario, it is not that there is only dental pain, okay. India lands at a top high rank, a very high rank, as long as we talk about the oral cancer. Now, other than oral cancer and tooth pain, there is an entire spectrum of diseases which maybe you haven't heard about, but they are very popular, they are very common. There's a disease which many people they don't know about, and this disease has nothing to do with tobacco. This disease has something to do with areca nut, beetle nut, okay, maybe green chilies, okay. So this is a peculiar disease where the mouth opening gradually keeps on decreasing. Like if you can open the mouth this wide, then gradually you can open the mouth this wide, then this much, and then this much. So like the mouth opening keeps on decreasing. So there are like varied kind of diseases. So and these are all very bad diseases, let me tell you. So this department, they are specialists in studying all these things and prescribing medications for this treatment for all these things. Then there is another department, another specialization, and another department to study, that is the conservative dentistry and endodontics. Now, when we say endodontics, endo means inside, so it is inside the tooth. So basically, here sort of a microsurgery is done in the tooth. So if you ever look into, if you do some Google and all, you will come across some picture of tooth, and in that picture of section of the tooth, you will see that inside there are a lot of nerves and blood vessels, and a lot of things are present over there. So when we perform a root canal surgery, so basically it is manipulation of the internal nerves and the blood vessels, okay, that is present inside the tooth. So there is a hole which is made, and you might see your dentist wearing some loop. So there's some binocular kind of things present. It's called as a loop. So you will see your surgeon is wearing a loop, or maybe a headlamp associated, or may not be associated. So because it's a very tiny hole, and through that work has to be done. So if we can see it well and good, but sometimes we take the help of those loops and we perform those microscopic surgeries inside. Nowadays, a lot of dental surgeons, they actually use a dental operating microscope, which is more similar to, like, if I want to draw some contrast, it is more similar to you can say the neurosurgeons, they use it, okay, that similar kind of microscopes. So here also such kind of microscopes are used, okay. So this is that department all about. So that is endodontics. But other than that, there are some simple tasks also which is done, like like filling, okay. There is when some part of the tooth is damaged, we try to restore the tooth, restore the damaged part. So that is called as restoration. So there are a lot of materials and all which are used, and that is the job of this entire department. Now, I can talk about another department and another subject to study, and that is called as oral and maxillofacial surgery. So, if we talk about oral and maxillofacial surgery, now these people are there is a big difference between a dental surgeon and an oral surgeon. Now, dental surgeon is basically when we talk about a general dentist. Okay, so basically, the dental surgeon is a general practitioner in the head and neck region. Like, you can talk about any department to that person, just like you can talk about any specialty to MBBS person. Similarly, you can talk about any of your oral problems to a dental surgeon. But if that dental surgeon requires the help of a specialist, then that dental surgeon can call upon any department and for and ask for help. Okay, and oral surgeon himself or herself is a specialist. Okay, they are hardcore surgeons, just like the life of any surgeon. You can talk about, say, a general surgeon, or you can talk about any other surgeon you can talk about. So this is the life of a oral surgeon. So oral surgery is a vast field, and their job is all about cutting and stitching, be it oral cancer, be it somebody's lip is not continuous, it is called as a cleft lip. So be it cleft lip, be it plastic surgery. Okay, be it jaw corrections. Okay, somebody's jaw is protruded, they don't like that. Somebody's jaw is retruded, they don't like that. So all these surgeries they will do. Okay, so periorbital surgeries they can do, or sorry, not periorbital, so orbital surgeries they can do, periocular I mean, or they can perform all these head and neck region. The oral cancer, so forget about it, that is so definitely is there. And everything is not always about cancer, there are other stuff also. And some of these oral surgeons, they are further, super specialized, and they are fellows. Okay, they perform fellowship in cleft lip, they perform fellowship in trauma. Okay, and there are a lot of dental surgeons who have uh, become specialist in oral surgery. Then they have become fellow in trauma, and they are present in leading hospitals in the trauma department. Okay, so some of them they do trauma, some of them they do plastics. Okay, there are lots and lots of specialization. So their job is purely the operation theater job, OT job. Okay, so that's another department present, oral surgery. Then there is another subject that you have to study, that is called as oral pathology. And in oral pathology, it is like the oral aspect of the general pathology. So here they will do the similar things, do biopsy and stuff, just like the general pathology does, but it is restricted to the head and neck region, the oral region. And then there is another subject that is called as orthodontics. Now, here I will make a comparison with orthopedics. Okay, so because orthopedics, their job is to rectify anything related to the bone, so is the job of a orthodontics. So ortho, that's why the department name is actually orthodontics or orofacial orthopedics. So not only they straighten the tooth, which is known to layman that my teeth are not aligned properly, I want to align my tooth, I want to align my entire teeth of the entire jaw. So this is what layman knows, but these people are more powerful than you think. So suppose a orthodontist thinks that your uh, front teeth is protruded, not because of the teeth, but it is because of the bone which is holding the teeth. Maybe this one, the teeth which are connected to the lower jaw, it is not the problem of the teeth, it is the problem of the jaw. So they have lots and lots of equipments and techniques. Without surgery, they will try to rectify it. Now, if that does not work at all, then they can refer you for a surgery. They can perform the surgery, or they can ask a oral surgeon to perform a surgery. So, like, there's a huge work that can be done. Then you see, there is another department that is called as pedodontics. Now, to make it easier for you to understand, it is basically pediatric dentistry. So most of the people, uh, after birth, you take the baby to a pediatrician. Okay, what many people don't know, that there are some people who are called as pedodontists, who are basically the pediatrics of the head and neck region. So if the child has got any problem related to gum, jaw, tongue, okay, lips, entire oral cavity, say I give you a common example, the tongue tie, like the tongue which is freely movable, sometimes they're attached to the floor of the mouth. Okay, so and you want to see some specialist. Okay, so because in if you have visited ever a pediatrician, you might have heard or you might have seen that in pediatrics also there are further super specialization. Some pediatricians, they are pediatric nephrologist, pediatric urologist. So similarly, if you want to visit a super specialist who is dealing with the oral cavity of the babies, of the children, so a pedodontist is the person that you're looking for. So even there is a department like this. And in mbbs there is a subject called as public health. Similarly, there is a subject called as public health dentistry in bds curriculum. So you see that in BDS curriculum, there are so many subjects present, and I forgot to tell you that even before studying these subjects, there are two subjects that you have to study, two vast subjects that you have to study, that is general medicine and general surgery. So, without knowing general medicine and general surgery, you are going nowhere. So, these are the subjects that you have to study. Now, here in BDS, in additional to the theoretical and laboratory based learning, you also have to go for the clinical training. Okay, so everything is there, just like the mbbs people. And over here, you have to go on for a hands-on experience in treating the patients under the supervision of the faculty members. Okay, and the clinical rotations will cover specialities, and you will gain confidence. Okay, and after that you have to clear the exams. There will be whatever subjects I talked about, each and every subject will have an exam. So yes, here also the number is not very less, so you can just replay the video, rewind the video, and you can calculate how many subjects are there, and you can put it in the comment section also. All right, now coming up to career opportunities. So career, again, this is supposed to be a separate video, because this is huge. And basically this is the reason why every aspirant wants to become doctors or engineers, because these curriculum, they open up a lot of opportunities for you. So you can, if you want to do clinical practice, you can do clinical practice. If you want to be an academician, you can go for post graduation. Okay, you become some specialist and you can be a very good academician. You can do research. Okay, and the specialization that I'm always talking about, it is called as mds. Just like after mbbs, a person can go for ms, that is master of surgery, or md, that is the doctor of medicine. Similarly here, a person can go for, after bds, the person can again clear the exam similarly. Like over there, for mbbs people, there used to be an exam that is called as neat pg, which is, I think, going to change. But for the dental people, the exam is called as neat mds. So it's like same, it's neat pg or neat mds. So you have to clear that exam, and you can go for the mds curriculum. It's a master of dental surgery once again. So you can perform mds in all those previous subjects that I talked about. You can become a mds in prosthodontics, orthodontics, mds oral surgery. Okay, mds pedodontics, you can become a mds in any of these subjects. And once you are but anyway, if we come back to the bds part, so you have to clear these exams. So now if you have got your mom, dad, brother, sister, anybody at home, you can, if you have closely watched them, then you might have come across that somebody has got mbbs with honors. Okay, distinction. Okay, these are all different credits which are provided depending upon the percentage that you get. Similar things are available in bds also. Like in bds also, if you do good, you can get honors in multiple subjects. If you do very good, you can get a distinction in multiple subjects. Okay, so this is possible. Same thing. Okay, academically it is same thing. Preparation is same because it's the same common exam. Okay, so I'm just telling you what job that can a dental surgeon can do. You can practice, you can teach, you can do research, even if you want to join the forces. Okay, because in army, in the Ministry of Defense, even in Ministry of Home Affairs, okay, that's Central Armed Police Forces, in both these cases, the MBBS people are eligible, and so are the BDS people. Okay, there is a requirement of lot of dentists in both these cases. The recruitment goes differently, but again, if you want to know about that, then you can again let me know, so that I can make a video on that as well. Or if you know it, then yes, you know it, then it's a very good opportunity. So it's this is all about the BDS. So you see, both has got the similar duration of course, almost both have the similar number of subjects, plus minus 3 4 subjects will be there. Like, I'm not talking about the MBBS people, because this video is all about the BDS people. And MBBS, I'm expecting, if not all, but some definitely, like what are the specializations that go on, like anesthesia, obstetrics and gynecology, ophthalmology, ENT, that is otorhinolaryngology. Then there is dermatology and venereology. Then there is general medicine, general surgery. So you know that. So I'm not going into that part, or that's a different topic altogether. But if I talk about the similarities, there are lots and lots of similarities present. Curriculum, if you see, anatomy, physiology, biochemistry, pharmacology, microbiology, pathology, general medicine, general surgery, these are all common subjects. And not only they're common, like just like while going for general medicine and general surgery, you also have to go to the hospital rounds, you have to see patients, and you have to make diagnosis, and there will be exams also on that. So don't think that these are to be taken lightly, or uh, just it's a gimmick or a eye wash. No, it's not like that. There are exams also on that. Just like in MBBS, in general surgery, you get short cases, long cases. So similar things happen over here as well. Anyway, so you see, all these things, career opportunities, the final, that licensing exam, so they're all same. Just that the focus of study in for MBBS is like more general, but this is more like the focus is more like as if it is a self specialization subject. Okay, it's very much focused in the head and the neck region. Specialty areas over there, like I said, different. Here there is periodontics, so over there it is pediatrics. Okay, there is internal medicine, surgery, psychiatry. Okay, these kind of subjects come over there. Here we have endodontics, oral surgery, orthodontics, just like I said. So these are slight differences present. So similarly, clinical training is a little bit different. Okay, so here, along with diagnosis, there is a lot of skilled work that you need. That is why the name of the curriculum is dental surgery. It's not just medicine or dentistry. No, it is called as dental surgery for a reason, because if you ever have visited a dentist anywhere, not only in India or abroad, you will come across that a situation very rarely that this person is just seeing you, diagnosing something, writing a prescription and releasing you. No, a dentist always has to do some work. You have to actually do some operative procedure. You have to operate on the person, like maybe surgical, non-surgical, but you have to do some operation on the person's body, or on the person's mouth, oral cavity, so here the practice and the training, like the practice, hence the training. Okay, this is a little bit different. And accordingly, the internship is also managed. Okay, so other than these slight differences, the curriculum is same. Let's not get into the discussion about vacancies and all, because the place where I live here, a couple of months back, even lots and lots of MBBS people, they were actually asking, they were seeking help for employment. And this is a case for dental surgeons since a pretty long time. But you should not judge a fraternity based on that. The fraternity is good, and the fraternity is exciting. It has got the fraternity deserves the same respect. Now, where saturation, market saturation is there, how many doctors are coming up every year, and how many patients require such kind of treatment and all. So these are all this is a more of a different discussion. And yes, to some extent I also agree that this discussion is required, but I think that will be a topic for some other video. Anything, any query you want to ask, you can put it in the comment section, and I'd be happy to answer back on that. So that will be all for today. I think a lot of people have got some little bit of extra knowledge from this video. So thank you, and Jai Hind.